So the report that we've seen recently, I mean, that's part of the recommendations that we've been working with the health department on, is trying to take the efforts to stabilize and address the lead paint issues.
Is the school safe for kids to still be inside right now?
Yes, according even to the health department, the schools are deemed safe.
Okay. And what specific steps have you guys taken so far to lessen the risk of lead exposure there?
Well, we have certified lead paint renovator painters that have been stabilizing and encapsulating areas that were of concern. So we've been doing that along with additional deep cleaning methods that we're going throughout the building.
If they've been doing that, is it working?
Right now, we are going through efforts to walk through and continue with walkthroughs with the health department, looking through their recommendations, and also just from cleaning practices. We're also soliciting services from a certified restoration contractor to take a look at our current methods and our compliance. So yes, we do believe we are moving in the right direction.
You believe it's working even though levels nearly 20 times the recommended amount were found inside that school?
Well, we also have to look at the report. If you look at it closely, that there was averages done. If you look at site-specific areas, so you have to look at the context of the overall report. But is it alarming? Yes. But again, there are methods that we can move forward to address those concerns with the recommendations with the health department.
Is all the work done tonight, all the deep cleaning and all the painting, the remediation of the lead paint, has all that been taken care of tonight?
We've been ongoing with those efforts for the last couple of weeks. And again, we're trying to take a look at where there's areas that we can do work better in certain areas. But again, we're also working with the health department based on their recommendations. Even along with the report, these are all things working to stabilizing the surfaces that contain lead paint, because any building could be a school, hospital, house, whatever, that was constructed before 1978. Lead is present not only in the city of Milwaukee, but across the state.
What do you say to parents tonight that say they're not willing to risk it? They don't want to send their kids to school.
I would not think that way, because right now even the health department has deemed the school sites safe. So I would contest that. I'd ask the parents to send their students to school.
The report from the health department basically says it took at least a year of essentially maintenance shortfalls that led to the lead levels being at this point. What do you have to say about what hasn't been done to allow this to happen?
Well, I guess that's kind of an assessment from the health department. I not necessarily 100% agree with. I mean, we do have cleaning practices in place. And again, if there's a way to improve things, because one of the things that we've also looked at, we understand that we're looking to make sure buildings are safe. And once this was brought to our attention, we immediately had people around the clock working overtime, second shift, and working on over the weekend. So we were treating this very as a serious matter.
It's been our understanding that you guys have had a lead, assessment team within MPS in place. So what have they been doing for the last several years if they haven't been managing properties that are coming up with high lead levels?
Well, again, you have to assume that it's when you look through sites, again, it's not just the city of Milwaukee, but also other areas where schools, buildings, houses, etc. You just assume that if the building was constructed before 1978, that it does contain lead in the painted surfaces. Over the years, I can assure you that there has been painted coatings, numerous coatings across all our buildings. Again, you encapsulate and stabilize the situation.
Right, but respectfully, we're not talking about other buildings within the city of Milwaukee. We're talking about buildings that house children. A majority of the children in Milwaukee go to Milwaukee public schools. So why wasn't something done prior? Why are these levels so high? It doesn't, I'm not understanding, I guess.
Well, we're utilizing certified people to stabilize lead painted surfaces. And again, if it's a matter of cleaning, like I mentioned, we're also looking at soliciting additional certified restoration contractors to get assistance and take a look at practices and methods of cleaning. We're also using wet wiping, we're using HEPA-Vax. These are all typical cleaning policies, disposal of cloths, etc. That is typical standard deep cleaning when you're dealing with lead paint.
Do you think that some of these practices need to change, since obviously these levels are higher than anticipated?
I would look at that's why we're soliciting services from an outside certified restoration contractor to see if there's other methods that we could look to. Again, working with HEPA vacuuming. If we have one that's placed at each site, and then also wet wipes, and then also disposable cloth. I mean, that's part of the practices that we're looking to work with.
If you just were considering shutting the school down, and so is there a plan for where all these kids would then go?
That would have to be a decision, discussing that with the health department, but no.
So it's not in consideration right now?
Not that I'm aware of.
Are the students safe in the building right now?
Yes, as we went over before, yes, they're deemed safe, even working with the health department.
So the district's policy says that it does annual assessments of each building, right? Do you know when Golda was last annually assessed?
Right
Or
now,
when?
whenever we walk through, I mean, we have certified people that walk through the buildings, and whenever you see something that's any type of compromised paint condition, laid paint, we have a work order system that when those are things that are entered and put into place, we address.
The first deadline by the health department is coming up on Thursday. Do you feel confident that the district will be able to meet all of those deadlines that the health department has imposed?
Well, that's one of the deadlines that we're working through as part of the stabilizing piece, and we actually have efforts where we're getting ahead of things, working with the cleaning piece. But technically, according to the order, we do have till next Thursday. So right now, we're thankful that working with the health department is a collaboration that we're trying to work through this because it's kind of a preliminary walkthrough.
Prior to the most recent lead risk assessment conducted at Golda in a year, when was the last time that a lead risk assessment was conducted?
Again, as mentioned before, we assume that there is lead in a building that's been constructed before 1978. You could do assessment all you want. You don't know it. You absolutely know it's present.
Has there been a lead risk assessment conducted before the most recent one at Golda in a year, or has there been?
Again, by the time you do the assessment, you already know what the answer is that there is lead paint within the
But
painted
we
surface.
can assume that there's lead in every building, but I think what we're trying to nail down is like, do you have a record or something that shows the district went through the building and said, nope, it's clear, it's all good, like within the last year?
What we do is we have staff that's on site, working with administration, that if they notice there's any compromised, I'll say paint surfaces, that they're supposed to enter a work order in, and we're supposed to use our certified people, which we do have on staff, and we do have to address it.
And so has that happened in the last year at Golda, before this all?
Whenever there's something that's identified that we know we need to address something, we will address it.
So are we not following MPS policy, or
It's
because
not.
the policy according is that every annual there is an inspection and an assessment done. So is MPS not following that policy?
Well, it's not even so much a policy, is that we do have staff that's in the building every day, and if there's something observed, it's supposed to be entered in. So I wouldn't even say it's annually, that it could be very much daily if something's been observed.
Do you know offhand how many district buildings there are and how many were built before 1970?
I don't have that exact number, but I mean, right now I want to say it could be potentially like 100 or so buildings.
Total?
Without knowing exactly, but I mean, we do have quite an inventory of buildings because our average age of building is 82 years old.
So I'm sorry, the number you just gave was pre-1970 or total?
With the exact number 1970, I mean, again, from World War II, we had a lot of buildings in the 50s, but again, from 78 and earlier, I don't have that number exactly in front of me, but again, I just do know that our buildings on average are 82 years old.
For several years now, we've been talking about a long-range facilities plan. Several months ago, it was released that some schools are being considered for consolidation and possibly closing down. Golda Meir was not one of them. Is this now going to be reconsidered for the long-range facilities plan to shut down some of these schools that are testing positive for higher lead levels?
I would say yes. I mean, there's something we have to take a look at from the long-range facilities master plan. It's numerous things to it. You have to look at the facility if it has like a specialty program, maybe some of the deferred maintenance. Does it ADA accessible? Does it have an elevator? But also too, we have to look at utilization factors, if it's undercrowded, overcrowded. So that is a complicated decision that needs to be made, because also too, we definitely need to get feedback from the general public, and right now we're going through steering committees from the regional and citywide effort to have those conversations, but that is part of the equation. I would say yes.
I believe it's 85% of MPS buildings that were actually built before 1970. That's the number that was previously provided from the district. So assuming that a large majority of MPS schools were built before 1970, assuming that means that there is lead present in the school, what is your response to parents saying that they feel like the district has failed in keeping those schools clean of lead and doing what is needed to be done to keep their kids safe?
Well, I have to take a look, from our cleaning practices again, that we are looking to work with a certified restoration contractor to look at anything that, if there's improvements we can do and work through that. But I would have to say, it's like, again, anytime this was brought to our attention, that we have addressed it immediately. And right now, just remind everyone that, according to the health departments, our buildings are deemed safe.
When I asked about those maintenance shortfalls, you mentioned parts of the reports that you disagreed with. Are
I wouldn't say I disagree with the results. It's just the way, if you look at the overall, some parts of the results, they look and do an average across all the spaces that they tested across the whole floor. So then they kind of deem that, and if you had a certain one that had higher, it kind of influenced the rest of the numbers. So I mean, if you look at all the data across each space, I'm just trying to put that in a context, and I'm not disagreeing with any of the results that the health department has provided.
Some of those higher numbers, though, were windowsills, and that's easily accessible for kids to be touching. And you know, the health department talked about a lot of younger kids touching surfaces, touching their mouths, touching their faces, and not getting in. So, is that not a concern?
No, it's absolutely a concern. I mean, one of the methods we're also looking is how do we encapsulate those surfaces. Is, again, we got older buildings with older paint that, you know, we have to make sure that we're keeping those areas stabilized. No, but it's an absolute concern.
The health department mentioned today that in addition to Golden Meyer, Kegel Elementary, as well as Maryland Avenue Montessori, also have had positive lead tests come back. Are there any additional actions that have been taken at Kegel and at Maryland Avenue to address the situation yet?
Currently, right now, the only reports and any data that we truly received from the health department is only from Golda Meir. We're going based on conversations and preliminary walkthroughs that we had at Maryland Avenue in Chicago, and right now we're trying to use the same methods that we were working with Meir to address anything. And again, we're looking at all the practices as well, but we do not have anything in writing as of yet that we're waiting on from the health department.
Do you feel like MPS has enough staff on hand to address lead in its building?
Currently, I mean, from the possibility of where you have to have certified people to address anything that you have to stabilize and encapsulate, at this point, yes, that we'd have to take a look at that. Is there certain methods and practices that we look that we can do? We're definitely doing that, and with our lead compliance plan that we currently had, we're already looking at these current, I guess, recent events, that ways we can tweak and make improvements.
I know that there's specifics to lead paint remedies and removals. You kind of just touched on that a little bit, that people have to be OSHA certified and certain, you know, they have to have a certain face mask that fits their face right. You have to put tarps up. It's very specific how you're either painting over or removing lead paint. So are there enough maintenance workers within the district who are certified to assist in remedying the situation?
Well, we use our own certified people, but also we have staff levels that we work with outside contractors that are also certified too. So we do understand where, you know, how much of the volume of work that we do bring on outside firms and contractors to assist that are certified.
What do you tell parents who are concerned right now, sending their kids to school now?
Again, according to even the health department, the buildings are deemed safe to attend school.
Acknowledging it's fluid, any ballpark on how long it takes to clean a building like Golda Meir?
Well, it all depends. Taking a look at results, you know, certain things, if there's, depends how old the building is, etc. Everything's unique, and as we all know, Golda Meir is a very old building, 100, I want to say 40 years old. So it's a very old building, so each one's a little unique, but again, you have to take a look at square footage, amount of people, and also just the materials that you're working with within the building.
I'm guessing you wouldn't be prepared to say by May 1st this building will be clean. Do you have a target date in mind?
No, I mean, right now we're looking at methods as well, working with certified restoration contractors to see if there's certain areas and practices that we can work with. Because again, part of what needs to be done is you're using HEPA-Vax, you're using wet wipes, and then you're using disposable cloth. That's pretty general that even restoration contractors do. We're trying to take a look at if there's certain ways that we can work with our methods.
What day did the district start cleaning Golda?
We constantly clean the building, so it's just a matter of, you know, when it was brought to our attention of something that was brought from the health department, there might have been some different practices, but our buildings are continually cleaned.
In response to this specific concern now,
Sorry?
when did the district start cleaning Golda in response to learning about a child who had tested positive?
Well, when we were notified, I want to say, I mean, it was right after the holidays. We got back from the new year. We were notified, I believe, on Thursday. There was also on the Friday. We immediately had people in working long hours over the weekend addressing things. So once we found out, we addressed this immediately because, again, we treat these matters very seriously.
So since mid-January, the district has been doing ongoing cleaning work in Golda, and that work will continue?
As of right now, anything that we got recommendations from the city health department and also stabilizing painted surfaces, it's a continuing effort that we're trying to take a look at things. Again, we've been very closely working with the health department and we're looking at their recommendations, and we do appreciate their assistance walking us through it as well.
The health department also released some water testing data that shows that water faucets in the bathrooms at Golden My Year were testing pretty highly for lead. Are there any signage that has been installed at these water fountains to know that the water is safe? And is there anything that's been done to address the lead in the water at the faucets?
Well, our department didn't get released that information. We actually saw it was online after the press conference earlier for the water test. For what we saw, there was certain areas that were, on there that were wash sinks. Again, if everyone would know, is that in Milwaukee Public Schools, all our potable plumbing devices all have water filters, and we have that throughout the entire district. Again, we'll take a look at certain one of those, but again, if we're looking at bathroom lavatories or slop sinks, that's something we'd have to have more of a conversation, because just from what I saw in the results, I think that's where that was that realm.
Is there any signage up at these bathrooms that children are using that would
Yes.
note that at these specific faucets it's confirmed that there are like signs that say that the water is not safe to drink?
Well, we put it's for hand washing only, because again, we're hopefully expecting children not to be drinking water out of a bathroom lavatory. So again, all our drinking fountains, school sinks, etc., do have water filters on them, but we do have signs up for hand washing only.